Hello, guys. I am just finishing up my phlebotomy examination and I passed it. Thank God. I passed it with an 86%. And I just wanted to make a video while it was fresh on my mind of some of the questions that I was asked and maybe go over a practice test with you all. Practice test is like 100 questions. So I probably will not, upload the whole thing in one day. It'll probably be in increments. But nonetheless, it's still good information, and I'll go ahead and upload that. So we better go ahead and get started. Now, I do remember that they had questions about PPE, so make sure you know what your PPE, correct PPE to wear in the correct situation, whether you need a gown, a face shield, mask, or goggles. And know your contact precautions, your airborne precautions, your droplet precautions, and make sure you know the different organizations as far as Joint Commission, CLSI, the CDC, HIPAA, NIOSH, and OSHA. So make sure you know all of those things. I do remember that they had some questions on the test, and on, let's see, well, we'll just go ahead and get started. So question number one, a phlebotomy technician should identify which of the following additives is used to prevent the breakdown of glucose. And the correct answer is sodium fluoride. Okay. Next question. A phlebotomy technician is an outpatient. A phlebotomy technician in, an outpatient setting is identifying a patient before performing a venipuncture procedure. To confirm the patient's identity, which of the following questions should the technician ask? And the correct answer on this one would be, would you please state and spell your full name and provide your date of birth? Number three, which of the following is a potential consequence of a phlebotomy technician mislabeling a blood bank specimen? And that will result in a transfusion reaction if you mislabel a blood bank specimen. Number four, a phlebotomy technician should invert anticoagulant tubes to prevent which of the following complications? And that's hemolysis, which is the destruction of red blood cells. Okay, number five, according to OSHA standards, which of the following vaccines must employers offer to their phlebotomists at no cost? And that is hepatitis B vaccination. It should always be offered at no cost. Hep B. Okay. Number six. During a routine venipuncture, a phlebotomy technician notices that a patient is becoming pale and sweating. The technician should identify that the patient is at risk of syncope, a syncope. Okay, once again, if you need me to give you choices or something like that, just message me. But there's just so many questions. I'm just trying to kind of go through them. Okay. And some of them I will go through actually. So number seven, the phlebotomy technician should identify that which of the following tube selections indicates the correct order of draw. And I'll go through these. A, lavender, green, gray. B, green. B is gray, green, lavender. C is green, gray, lavender, and D is green, lavender, and gray. And the correct answer is green, lavender, and gray for the order of draw. Okay, number eight, a phlebotomy technician is preparing to collect a blood specimen from the antecubital site of a patient. Which of the following devices can be used to stabilize the arm for a collection? And that would be the phlebotomy wedge. Okay. Number 9, a phlebotomy technician is preparing to use an evacuated tube system to obtain a venous blood specimen from a patient. The tourniquet is in place and the technician has cleansed the puncture site. Which of the following procedural steps should the technician perform next? And basically, after that, you should just uncap the needle and inspect it. So that's the correct answer. The next step the technician should take is to uncap the needle and inspect it. Number 10, which of the following actions by a phlebotomy technician can result in a grossly hemolyzed specimen? And the correct answer is using an incorrect needle gauge. Incorrect needle gauge. Number 11, a phlebotomy technician should identify that which of the following series of venipuncture steps is in the appropriate order. I'll go over these. A, insert the needle, place the tourniquet, and label the tube. B, assess the site, cleanse the site, and insert the needle. C, identify the patient, cleanse the site, and assess the site. And D, draw the specimen, remove the needle, and remove the tourniquet. And the correct answer is B, assess the site, cleanse the site, and insert the needle. 12, a phlebotomy technician should comply with HIPAA to protect which of the following? And the correct answer is a patient's information. HIPAA protects a patient's information. Okay, 13, a phlebotomy technician is performing a capillary blood collection from an older patient. Which of the following sites should the technician select? And the distal of either middle finger. So it's the two middle fingers on the sides. You never do it in the tip, so it's just on the sides of the middle fingers, the two middle fingers, never the pointer finger, never the pinky or the thumb. Okay, a phlebotomy technician is preparing to collect a blood specimen from a patient who signed a general informed consent form upon admissions to the facility. Which of the following actions by the patient indicates implied consent for the venipuncture? And basically, just rolling up the sleeve is implied consent. Okay. 15. A phlebotomy technician is using an evacuated needle holder and blood collection tube to collect blood from a patient. Which of the following actions should the technician take? A, position the needle at 45-degree angle to the skin. B, insert the needle. Insert the needle with the bevel side facing down. C, palpate below the puncture site if blood flow is not established. And D, push the first collection tube gently in the holder. And that is the correct answer. Just push the first collection tube gently into the holder. And this is just, you can just use a process of elimination for those questions. For an older adult patient who has difficult to access veins, a phlebotomy technician should select which of the following veins to perform a venipuncture. And the correct answer for a person that has hard to access veins, an older person, you should do the dorsal veins. The tech should select the veins on the back of the person's hand, the patient's hand, because that might be the only accessible site if a patient is older adult who has difficult to access veins. Back of the hand. Okay, and 17, How often should a phlebotomy tech run quality control tests on a point of care testing instrument? And that answer is daily. You should run them daily. Okay. 18. A phlebotomy technician must comply with which of the following OSHA requirements when performing a venipuncture? Um, I'll go through these. The first choice, A, recap contaminated venipuncture devices to reduce exposure incidents. B, wear safety glasses if splashes, sprays, splatters, or droplets of blood might be generated. C, wear gloves when contact with blood is anticipated. And D, report a blood exposure incident to the superior within 48 to 72 hours. So we know that it's wear gloves when contact with blood is anticipated. The other answers are just wrong. We know we don't recap. We don't wear the safety goggles if glasses. It doesn't even say goggles. It says glasses. So we know that that's wrong. And we don't report blood exposure incidents 48 to 72 hours later. That's a long time. You're supposed to report them immediately. Okay, 19. Which of the following actions should a phlebotomy technician take when performing a venipuncture using an evacuated tube system? And the correct answer, well, I'll just go through them all. A, position the needle at a 30-degree angle in the same direction as the vein and with the bevel up. B, position the needle at a 15-degree angle near the vein and with the bevel up. C, position the needle at a 30-degree angle in the same direction as the vein and with the bevel down. D, position the needle at a 15-degree angle near the vein and with the bevel down. So you can just eliminate. We know we don't put the bevel down, so that eliminates the last two. And we don't. Okay, let's see the we do not use the 15-degree angle either in this situation. So it would be position the needle at a 30-degree angle in the same direction as the vein with the bevel up, always up. And 20, a phlebotomy tech is collecting a blood specimen from a patient to measure the trough levels of medication. The technician should collect the specimen at which of the following times? And that would be within 15 minutes before the patient receives the next dose of the medication. Um, so once again, that's within 15 minutes before the patient receives the next dose of medication. Okay. So know those the peak and trough values. Okay, and I'll do a couple more. Number 21. For which of the following tests should a phlebotomy technician follow chain of custody guidelines? This is going to be on the test, I remember. And that's blood alcohol. When you get a blood and alcohol test, they will paternity test, all of those, because some people have court cases and that follows the chain of custody, those types of blood tests. Okay. And 22, during a venipuncture, a patient reports a sharp pain radiating down his arm. Which of the following actions should a phlebotomy technician take? So you should just release the tourniquet and remove the needle and stop the blood draw. Okay. 23, a phlebotomy technician is teaching a patient about collecting sputum specimens at home. Which of the following instructions should the technician include? Okay, so they should include the information to tell the patient to spit thick secretions into the container after coughing deeply for sputum specimens. Sputum is a thick secretion that is obtained from the lungs and is used for testing. Coughing deeply ensures that the majority of the fluid in the specimen is sputum and rather than saliva. So, okay. And that is all for today. I will come right back on and record the rest of these questions. Hopefully, I'll do more tomorrow. But just give yourself time to know these, study these questions because these are the questions that basically helped me pass the exam. Now, there were 20 extra questions on there that I wasn't aware of. I thought it would be 100, so not 120, but you will pass if you know these questions. All right. Thank you, everyone, for tuning in. And just make sure you tune in to my part two. Thank you so much. And I will, well, I won't talk to you all unless somebody needs me to answer another question for them. Message me. But until then, goodbye, everyone.